This morning, instead of our regular bring, brag, and borrow, we've got special guests from Idaho. Marilyn Sword, who you're all familiar with because she joins in our monthly meetings, and Sarah Taves, who is her partner at Boise State University. And they're going to talk to us this morning about their strategic planning. And afterwards, we're just going to kind of discuss how this might differ from sustainability planning and whatever else you want to talk about. But just have to say, I'm really excited and thankful that they're here. And Marilyn and Sarah, do you need an introduction or do you just want to jump in?
You can do introductions first, Susan, too.
Okay. Okay, let's go around so you know who's here.
Yeah.
So both Marilyn and Sarah know me. I'm Susan Summers, and I'm art staff that's helping to facilitate this group. And everyone else jump in, and then we'll get a proper introduction before the presentation from Marilyn and Sarah more about them. So Abby, you want to jump in?
Hi, Abby Daraponsny with the New York State Office for the Aging.
Welcome, Abby. Glad you're here. And Hannah?
Good morning, Hannah Queering. I'm the Lifespan Respite Program Coordinator with DHHS in Nebraska.
So glad you're here, Hannah. And Taylor?
Hi, this is Taylor. I'm an intern at the New York State Office for Aging.
Hey, yay, Taylor, and yay, New York for having an intern. Doris?
Hi, good morning.
Hi, Doris.
Director of the New York State Caregiving and Respite Coalition. It's Friday. I don't even know where I work. Okay.
I know. I'm stumbling over my words today too. So, Corey?
Hi, I'm Corey with Helping Hands Vegas Valley and also the Nevada Lifespan Respite Care Coalition.
Corey, thanks for being here. And Regina Stokes?
Good morning. Can you all hear me?
Good morning, Regina.
I'll grab a camera here shortly. So I do apologize, but how are y'all doing? I am Regina Stokes. I am with the Tennessee Commission on Aging and Disability, and I oversee the Lifespan Respite Grant. And clearly I'm the only Southerner here on the call.
No, we're really glad you're able to join us this morning.
Yes, ma'am. Thank you for having me.
Yeah, sure. Stephanie.
I am Stephanie Red Elk, and I am the Lifespan Respite Voucher Coordinator, and I'm from Oklahoma.
Welcome, Stephanie. And Dina.
Hi, Dina Press, New York State Office for the Aging. We have a big crew here with us today. I'm the Lifespan Respite Project Director, and I also oversee the National Family Caregiver Support Program for our state.
Okay, thanks, Dina. And then we have a phone number, not sure who it's from, but whoever's on the phone.
It's me. It's me. I'm on.
Oh, you're on both?
Yes.
Okay. Okay, so that's.
I need to be mobile. That's all.
That's fine. We're glad you're here. Okay, so without further ado, let me reintroduce you to Marilyn and to Sarah Taves, and they'll tell you a little bit about themselves and how they work together, which is an important part of the story, that relationship and partnership, and share their strategic plan with us.
Okay. I'm Marilyn Sword, and I coordinate the Idaho Caregiver Alliance. Sarah?
Sarah Taves. I direct the Center for the Study of Aging at Boise State University and also teach in our Department of Public Health and Population Science. Delighted to know we have an intern on the line, Taylor. We rely heavily on the resource of our students as well to make this work tick, and it's an incredible opportunity to engage students in this work. So really good to meet everyone here. Want to let you know we are learning from all of you. We use resources from all of the work that you've done as we work here in Idaho. So delighted to join you this morning.
Okay, Sarah, you want to bring up our presentation?
You bet. I noticed a couple more people joined. If they'd want to do introductions, I think. Renelle and Mary Jo.
Let's see who else. Oh, Renelle. Oh my gosh, Mary Jo, welcome. So excited. So we just went through introductions, and Marilyn and Sarah are just starting their presentation, but Renelle, would you want to just let them know who you are, and Mary Jo?
This is Nadine. One of my staff
Oh.
person was Ronell, and every time I
Oh,
get on
that's
the
right.
Zoom meeting, I need to change. I am Nadine Walter, not Ronell. I just haven't had time to change my name over. But anyway, hi, I'm Nadine. I'm with Oklahoma Human Services, oversee the Lifespan Respite Grant, the 3 and 5 year grants that we have right now. So thank you.
Well,
Sorry.
we're thrilled you're here. We may
Yes,
have been more
sorry.
thrilled to see a baby on Renelle's lap, but I thought she was gone. But there we go.
Yeah,
we're really glad you're
she's
here.
gone taking care of babies. And I'm too old to have babies, so I'm not Ronell.
And Mary Jo, say hello.
I will. I'm disappointed I don't have an alias today. I am Mary Jo. Alameda Caruso. I had been very active in my state's Lifespan Respite Coalition, and I'm also with the Federal Training and Technical Assistance Center of Friends for community-based child abuse prevention.
Where are you from, Mary Jo?
I am from Pittsburgh, Pennsylvania.
Okay.
Me too.
Okay, do we have everybody now?
We've got everyone.
Okay. Well, thank you, Susan, for allowing us to share a little bit about what we're doing in Idaho. And I want to preface this because we were having a conversation with Susan and Jill before we started about this is, while there's a lot of overlap and joint work going on with the Lifespan Respite grantee, who's our Commission on Aging, and our Caregiver Alliance, which is housed in the Center for the Study of Aging at Boise State. The sustainability and strategic planning that we're talking about today is the Idaho Caregiver Alliance plan. So it's not the same as the Idaho Commission on Aging's plan, but I did want to make that distinction for you. So you want to advance the slide, Sarah? So just a little bit about our alliance. We came to be in 2014 with the first Lifespan Respite grant that we received. And we have been building since then. Our coalition now across the state is about 1,500 people, organizations, agencies, and we come together around supporting unpaid family caregivers, supporting, informing, and empowering unpaid family caregivers. And we have meetings 4 times a year on Zoom. And what that has done is really help us build our membership. Our quarterly meetings sometimes attract anywhere from 85 to 110 people. So that's really exciting. We are funded by through the Commission on Aging with funds from the Lifespan Respite program within the Administration on Community Living. But we have, we do some other things that generate a small amount of income for various activities, and I'll talk about that later. And we are organized under the Center for the Study of Aging at Boise State. Here's our kind of our operating principles, and you can see from our vision that its caregivers and care recipients are an important and critical part of Idaho's sustainable communities, not just being part of the healthcare system or anything else, but they're recognized as an important and valuable component of our communities. And our values of collaboration, community inclusiveness, and capacity building. And so our mission is to serve as the voice and the convener and the catalyst for support of unpaid family caregivers. We see ourselves as kind of an advocate and an incubator, if you will, for things that we might try. So next slide. So, in talking about strategic planning and sustainability planning, I found this, what I thought was a very helpful article from the University of Chicago Medicine. And I pulled this from that and modified it slightly. But really, I think we all know that strategic planning provides us as a tool to determine what we want to do, where we want to go, what data we need to get there, what resources we need to get there, and make sure that we have the stakeholders at the table to help us do that. We put our first plan together in 2016, and I'll talk about that more. But our plan really has 4 broad goals, one of which it relates to infrastructure and sustainability. And so where I said down at the bottom, a sustainability plan can be embedded within the plan or developed separately. We've kind of done both. And so we found that we've made a couple of stabs at sustainability planning. One, I think, well, it was pre-pandemic. So I think it was like 2018. And now we're working on one that's much deeper and broader. But sustainability plan really brings our partners together with us, the ICA, on how we can continue to do what we're doing and partner with others in terms of staffing and funding and what other organizational assets we can pull together. How can we embed what we're doing in other entities and partner with them that way? How can we, transition our leadership? What guidelines do we need to be flexible and open to opportunities for change and opportunities for innovation? So I think one of the things that we found, and we'll talk about that in a moment, is that we've done a lot of activities that are kind of ongoing and hard to quantify. A lot of the advocacy and public awareness and caregiver support. But it's when you have those specific things that you can point at, like we have an annual caregiver conference that we've been doing for 11 years. It attracts about 300 to 350 people every year now on Zoom. But that has attracted some financial support and partnership with some of our health insurance agency, our insurance agencies and others. So when you have a not bricks and mortar, but a specific program that you can point to, that people can see, a newsletter, a legislative update, a conference, that makes sustainability planning much more kind of user-friendly. So it's included in the plan, but it's really packaged differently, I think, in sustainability planning. Sarah? So here's just a little bit about our strategic plan. And as I said, it provides us the structure and the guidance to achieve the goals that we want to work toward. It took us a long time to develop the first one in 2016 because we wanted to gather a lot of input and voices and things as basic as, what do we call a caregiver? And then what do we start doing to meet the needs of caregivers across the state, respite and other needs? And so we developed a plan in 2016. And when Susan sends this out, there's 2 links. There's a link to our first plan and then a link to our second plan. But our first plan, the plan itself was prefaced by a several-page report that we used to educate people about the issues facing unpaid family caregivers. And so when we did our second plan, we didn't invest that amount of time. We moved the plan to the front and used that report that we had done with the first plan as an appendix to our second plan. Our plan has, I think, something like 13 strategic objectives under 4 broad goals. You'll see those in a moment. But what that's done is, because it's really macro level, it's allowed us flexibility to snag an opportunity to work on something that may not have been evident to us when we first developed the plan. As I mentioned, it includes an infrastructure sustainability goal. And much of the information that we put together for this plan involved all of our partners generating input and reviewing the plan and commenting. And we did a respite needs survey early on. And then both Jill and Susan have been to Idaho for respite summits. We've done respite summits in every region of the state where we bring together family caregivers and others and learn from them. It's their opportunity to meet each other and share information with us about what their concerns are, so that that information can be embedded in a plan, or we can amend our plan to accommodate kind of a change in direction or new information. And as I mentioned, we use it as a tool to manage what we're doing and take advantage of opportunities that present themselves. We review it every year, although I have to say for the last couple of years, we've started in on a work plan and kind of done that hit and miss, because we've been so preoccupied with a demonstration project that we're operating, as well as just dealing with COVID. So, but we use the plan to explain what we do to people who don't know about the Idaho Caregiver Alliance. And we have included it on our website so people can access it at any time. And when we do our monthly newsletters out to that 1,500 person list, we say, if you want to work on updating our work plan, please contact me. So we're always kind of encouraging people to be part of our planning process. We also have a leadership team that meets. It's about 30 people, and it meets between the quarterly ICA meetings. And that's just, it's not designated to be a certain number or a certain representing certain entities, but it's those folks who've been really active with the Alliance since we began. And it gives us a chance to just really strengthen and build those partnerships. Next.
Marilyn, I'd like to just add a comment that I'm hoping the group can maybe process after your presentation. But one of the things we're finding with our strategic plan is focused on lifespan.
Right.
And our funding comes through the Commission on Aging. Well, they have age-specific parameters. And so we are now feeling some tension between our lifespan perspective of the coalition or of the alliance and our strategic plan for that, and the mission and focus of the Commission on Aging. So I'm very curious to hear from all of you when we're done here is, how are you negotiating that lifespan perspective when your funding stream is coming from an entity or through an entity that has some very specific age-related parameters? So anyway, just wanted to add that, as I think people are reading our strategic plan and they're recognizing that we are lifespan, and sometimes lifespan is out of their purview and doesn't maybe align with what their vision and mission is. So we just wanted to add that to the table for discussion. But Marilyn, I'll let you go ahead there.
Thank you, Sarah. Thank you. This is a graphic of the Cascade model, dropping some of our work into this model. And I thought this was helpful for me because sometimes pictures really help. But you can see our vision there at the top, which overarches everything. And then our values of collaboration, inclusivity, and capacity building. Communication is also a value, but I feel like it kind of is a bridge across all of those. And then our focus areas are big goals. There's one on family caregiver support, one on building public awareness, one on changing the systems, and one on sustainability or infrastructure. So I'm using here one of our objectives, and that's, and I've highlighted, bolded family caregiver support because this is an objective under our family caregiver support goal. And it's to develop a statewide network of information and support navigators. And initially, when we were thinking about this, we were talking with our 211 system and others about how this might merge or mesh with what they're doing. We found that there was some overlap, but there's nothing really out there for caregivers. Everything seems to be focused on the care recipient. And that's the uniqueness of us, is our calling out of caregivers. And so I wanted to mention one of the ways that we're working toward achieving this objective is that our Medicaid Money Follows the Person grant, Idaho Home Choice, that has its major goal is to keep people out of institutions or transition them from institutions back into the community. They had some available funds. I think it was 2018 and 19, and they are represented on our leadership team. So we knew about it from that communication. But we wrote a proposal. A colleague and I wrote a proposal to Medicaid to fund a Navigator project that we had heard from caregivers around the state when they first become a caregiver. It's often in a crisis and they are often overwhelmed. And when they seek they don't even know where to begin to seek information. And when they do, it's often filled with lots of pieces of paper, lots of booklets, lots of acronyms, and it can just be overwhelming. And what we heard was, we would just like somebody to take us by the arm and help us plug in to the information we need at that point to help us on our journey. And so that's what we proposed to Medicaid. And we have done that. Well, this September, it will be 2 years that we've demonstrated a family caregiver navigator project in Southwest Idaho in collaboration with our area agency on aging and our commission on aging. And we are using the T-Care or tailored care platform so that navigators, caregivers can contact a navigator by phone or email, and then they go through an assessment. And then the navigator works with the caregiver to develop a plan based upon the needs identified in the assessment, no more than 2 to 5. We don't want to make it more work for the caregiver. And then the navigator does a warm handoff to resources in the community that they're aware of. And we're building that resource library all the time. And then touches back in with the caregiver at regular intervals. There's a 3-month touch in, a 6-month. If the caregiver doesn't need the assistance anymore, that's fine. It can be closed out. If they need help or their situation changes prior to the 3 months, they can call and connect with the navigator at any time. It's free. And I think we've touched maybe over 300, I think, Sarah, caregivers since that time. And so some of the performance indicators that we're looking at are we invested heavily in outreach at the beginning because we understood that caregivers don't self-identify. So we did a lot of work on the front end to develop the marketing materials, videos, handouts, webpage, social media platforms, so that people would know about us, so that we did a lot of presentations about this. And we have currently, I think we have 5 navigators part-time. Some are social work students, some are public health students. That's the advantage of being housed under the university. And then they are providing this ear and resource and support to those caregivers across the lifespan. This is anybody who's a caregiver, who's an adult caring for anybody from any age. They are welcome to call or contact our Navigator Project. And one of the things that we're able to utilize the TCare platform for, and I know that Dina and the folks from New York are familiar with that because they're using TCare, is we're looking at to what degree this is decreasing the depression and stress, increasing the knowledge and capacity, and decreasing the identity discrepancy of the caregivers that call in and access this service. So that's an example of us being able to move quickly to write a grant, to get some funding to support a very specific project that is, we hope, has a systems change effect going down the road. We have received funding, additional funding from Medicaid to expand this to another area of the state in collaboration with a different area agency on aging. And we've also been in partnership with our Commission on Aging as they move to enhance and kind of restructure their adult protective services, so that this Navigator intervention can be an early intervention in that system. So we're focusing on that in a time-limited way. So that's an example of our plan and how we can activate one of the objectives in our plan when a really strong opportunity presents itself. Sarah, do you have anything you want to add before we move on?
I think I just want to highlight the reason that Marilyn has kind of spent some significant time on describing this intervention is that it provides us with the tangible evidence for a sustainability plan. Because I think in order to make a strong case for why a coalition, like what's a coalition? What do they do? It's, as Marilyn indicated early on, it's really hard to measure. It's really hard to capture these broad collective impact systems that are working to change. And I think so this very tangible piece is one of those pieces of that's been critical to, I think, our strategic plan as well as our sustainability plan. And I want to just to highlight, you never know who your partners are. Medicaid has been very clear here in Idaho that they do not see themselves expanding services to embrace or envelop the caregiver. While they're telling us that, they are also providing us with funds to test something that does just that. So it's kind of one of those, you just never know. So don't, it's turn every rock over to check to see if would this maybe be a possible advantage for an organization that really can't be the public face of this testing something for the caregiver, because that's not the politics of Medicaid here in Idaho, but they can allocate resources to us to do the testing. So it's been one of those interesting pieces of how you actualize the strategic plan and again, produce that evidence that you need to support a sustainability plan. I'm not going to spend any time on our logic model. I think you've all seen it, but this is how we've kind of operationalized our strategic plan in a one graphic visual of these are the efforts of what the goals and activities of the Idaho Caregiver Alliance, and hopefully a little bit more succinct than our strategic plan document. And it's been a helpful information tool. But and Marilyn, I'll let you take it away with the sustainability.
Okay, sustainability is a piece, as I mentioned, of our strategic plan. But one of the things we found is it needs more attention than that. And our early sustainability efforts, we did kind of with the leadership team and developed a 2-page kind of white paper that we looked at different models of sustainability. We put this together with a little, caregivers are this invisible, important part of the long-term care system, an important part of our communities. And so it included the goals from our work plan, and it included some funding, estimated funding costs for what it would cost to staff and operate a caregiver alliance like we currently have. And we used it also to reach out to policymakers and other partners, looking again for partnerships, funding and otherwise. But we really didn't go any further than that. We have been able to maintain our sustainability to date through the funds provided by our Commission on Aging from the ACL Lifespan Respite Grant. We have learned recently that the Commission on Aging may not be seeking a 4th grant if in fact another round is available. So that's really kind of lit us on fire to get moving in terms of where else might we get the support we need to continue, because really we think that the services and supports and education that we provide is really important for caregivers in Idaho. Would hate to see us go away if that grant funding was not available to us. So we've retained a consultant who's really been wonderful in helping guide the process to develop a sustainability business plan. And one of the things when we started this, we were looking to develop a sustainability plan for that Navigator project that I just described. But the more we talked about it and shared it with others, we realized that what we really needed was a sustainability plan for the Idaho Caregiver Alliance, and that the Navigator project we could hold up as an example, a demonstration of what we were capable of, presented with some time and funds, that because we are flexible and innovative and outside the silos of a lot of the public systems, and we have folks on board with us who represent healthcare systems, policymakers, other state agencies, that we can draw on their knowledge and connections and move rather adeptly at demonstrating something that then could be incorporated in one or more systems down the road. So the consultant and one of Sarah's colleagues have done interviews with many of the folks who were involved with the Navigator project. We have an advisory committee for the Navigator project, as well as an advisory committee for our Hispanic communities, with reaching out the Navigator project into our Hispanic communities. So we've got a lot of folks that can provide information to us about what do they see as the assets that the ICA has, and how might we continue, what might we focus on, what might we message what we're taking to potential funders or supporters in other ways. So that last bullet about emphasizing that we operate kind of outside of silos. We call ourselves silo busters to emphasize work that needs to be done across the lifespan in support of those family caregivers. Anything you want to add, Sarah?
I just want to highlight this value of having an external group looking at us, because what they heard from the interviews is, while the Family Navigator program is powerful and they're seeing results, those interviewees kept referring back to the Caregiver Alliance. We were undervaluing ourselves. We had kind of lost really the notion of how important it is to have this lifespan alliance. And so it's truly the focus of our sustainability plan shifted based on the learnings from these stakeholders that were gathered through these interviews that the consultant and another student conducted. So again, it's been so valuable to use that external partner to help us continue to reflect and hear what others are valuing in the work that we're doing.
I'm going to let you tackle this one, Sarah.
Yeah, this is just an example of one of the tools that Monica Cuneo used. It's the mural platform. And this is a call out. This box here is just a call out of some of the, what the interviewers did then was trying to capture the themes that they heard from people. And then that's what we use to guide, or we are using, because we're not done yet. We're using these themes of what's valuable to our external stakeholders as the themes to guide how we're going to showcase and highlight the values of ICA, aligning them with the values of our external partners, which again, I think is key in sustainability. It's how do we demonstrate that we align and support their objectives and can be an advocate for them and a step in the work that they are doing. And maybe the work that they cannot do, even though they know they'd like to do it, they can't do it because they are part of a silo or part of a system that isn't in that same place about recognizing family caregivers. So a great tool that this has been to help us really aggregate that data from our interviews that were conducted and help us recognize what people were saying.
This value proposition is, you saw 3 at the top, pardon me. It's one of, well, I think there were 11 or so components to that. So it really was a very comprehensive examination of what we're doing. Here's an example focusing on sustainability. And that's why that is bolded under focus areas. And so here is one of our goals, one of our big goals. And it's dealing with sustainability, ensuring that there is a coordinated voice for family caregivers across the lifespan, because there isn't anybody else who does what we do. So the performance indicators for this would be are showing how we can demonstrate and be flexible and innovate. Our Family Caregiver Navigator is an indicator of that, our project. Piloting of a respite voucher program, which we did at the beginning with Area 3 Agency on Aging, and now that's being picked up statewide. We've done some evaluation of that and conversations around that with our Commission on Aging. As I mentioned, the virtual caregiver conference, excuse me, I'm sorry, which we just had our 11th annual conference, and we provide education, information, and training through that to caregivers, certified family homes, agency folks across the state. And this year, for the first time, we did a track entirely in Spanish for our Spanish-speaking family caregivers, because we felt like they had we need to move them to the top instead of always thinking of them after the fact. So, and so we're doing things that are demonstrating that we can make positive change in policy. And we have a legislative intern who works with me during every legislative session, and we monitor what's happening in the legislature. We can, and we share that information in weekly reports with all of our members. and give them opportunities to learn how to testify or write a letter to their legislator, or at least know what's going on in the legislature that has an impact on family caregivers and public health in Idaho. What's next, Sarah?
Oh,
that's us. That's it. So that's kind of, I would give you a link to the business plan, but it's still in development. We hope to have a draft next month, and we'll be happy to share it with you when we do. And then I think once we have that draft, we kind of have to launch into how are we going to use it? Who are we going to talk to? How are we going to kind of mobilize the message that the business sustainability plan contains? And it is focused on the ICA and uses the Family Caregiver Navigator as kind of the key example of what we are able to achieve. So we're happy to answer any questions, or I hope this was helpful to folks. And Jill, thank you for making it available.
So
and I'd just like to reiterate my question for the group as well, is thinking about our strategic plan in terms of lifespan and how others, and I know we have aging related offices here on this call, is how do you all align lifespan with your work under an office for aging? So,
okay. That was excellent and thought-provoking. Feel free, members, to unmute yourself, to add your faces so we can have a conversation about this. I have like a million things to say, but I'm going to make myself be quiet so we can hear from the group. Tell us what stood out for you and what questions you have.
This is Nadine from Oklahoma. I can start. I can answer your question, maybe Sarah, and then I have a question. We are with Oklahoma Human Services, which we kind of changed up our division, but we were aging and adult protective services. We've merged to community aging. It's a long name, but we call ourselves CAP now. When you combine two big divisions like that. So our 3- and 5-year lifespan respite grant are in the CAP division, which was aging services, and it's beautiful. I mean, we don't look at ourselves as aging services anymore. We look at ourselves as lifespan, because all the programs that we get funded, Older Americans Act, everything that we have, all that funding coming through there are helping family caregivers across the lifespan. So it's beautiful. And also we are in a huge state agency, which does have child welfare, does have adoptions, does have foster care. So, I'm fortunate I have all those connections. And even though it's huge agency, when you've been in it a few years, you get to know a lot of people. And so anyway, that I don't know if that answers your question, but we're pretty open-minded here in Oklahoma and helping everybody. And we try to get rid of some of those silos. And again, and just within our division, and a lot of that is, I always say, you're helping family caregivers, whether you're helping, nursing home residents, you're affecting that family caregiver. If you're helping adult protective services individuals, you're helping all ages. And so again, I'm fortunate. Maybe that answered your question. Maybe it didn't for Oklahoma. My question is, you mentioned several times about applying to Medicaid for some funding. How did that happen? How were you able to make that connection?
The woman who ran the Money Follows the Person project within Medicaid sat on our leadership team, and she informed us that these funds were going to be available. And what they were looking for projects that helped move them forward with their goals of keeping people out of institutions, or moving them out of institutions. And we felt this Navigator Project did that. It didn't, it provided caregivers with the support, the information, the skills to build their resilience to continue to be caregivers of people in the home. So they've been very pleased with what we have been able to do because we've continued. It was a 2-year grant. It's now going to be 3 years. We don't know what the future brings, but it did align our proposed project aligned with the goals of that program.
Okay, I've worked with Many Falls a Person in a COVID grant that I have that was very successful in getting individuals out of the nursing facilities. So you asked for funding for the Navigator program is the T-Care program. Is that what you're saying?
We're using the T-Care platform. So we've bought T-Care licenses for our navigators, and they've gone through the T-Care training as well as some kind of internal training we've done.
Right. With the Medicaid money.
Yes.
Gotcha. Okay. That clears everything up. Thank you. Appreciate your time.
Absolutely.
Great presentation.
Thank you.
And Nadine, check out Sarah's chat message too about money follows the person. That's related to what we're talking about.
Mm-hmm.
What else stood out for folks? I'm just going to jump.
I was just going to say
ahead.
there are a couple of other states that have used Money Follows the Person funds to supplement their family caregiver work. I have always encouraged that. It's a great source of potential funding. And we could talk offline later about some of those models that have been done in the past with those funds if you're interested in learning more.
The other conversation we've had with Medicaid around family caregivers is looking at our managed care programs here in Idaho and how we can actually change the contractual language that Medicaid has with our managed care programs to include a piece of caregiver navigation within that contractual agreement, which is it's a further upstream, it's an upstream strategy. And I continue to hope that there will be interest in that. But again, I think as Marilyn has indicated, it's about communication. It's about, the fact that this individual sat on our leadership team. She knew us, she trusted us. And it's all about that relationship and communication and how these things come about. We also worked with the healthcare strategies for healthcare innovations group several years ago. We were engaged in a learning collaborative with them. And I think that really helped us open some doors with Medicaid because they also have contracts with Medicaid agencies. And so again, it was one of those trust building opportunities where synergies came together and it opened a door for us to demonstrate our ability to do this work.
And I think building on that, we have representatives of both Blue Cross of Idaho and Molina Healthcare, who are two major healthcare insurers in Idaho, and they both have programs for dual eligibles of Medicare, Medicaid. And the representative of those two programs sit on our leadership team. And so we continue to have discussions with them about how can we, as Sarah said, move this upstream and include this as a service in their plans. So, and we've had conversations with other insurers and other healthcare underwriters, but those are the two biggies, and they are both very regularly involved with and supportive of what we do.
So this is Susan. Let me ask a quick question about that leadership team. That's one of the notes that I jotted down. You talked about those 30 persons who had been really active in the Alliance. And so I'm just wondering more like, how did that happen? How did you get them engaged? How did you get the right people? And this is the kind of stuff that's not very tangible, but I think is really, really important. How did those relationships happen? How did you keep people coming? And why is it worthwhile to them to stick with it?
I think originally it was Sarah, me, someone from the Commission on Aging. And then it just kind of grew from there. And people saw it as valuable in terms of gathering information for what they were doing. And so I think it really got its roots in communication about shared goals and shared activities. And so it's some people have dropped off, some people have joined. It's very fluid, but we, if somebody wants to participate at that level, they just have to identify and see it as value to them. And and we just encourage and support that.
So you're really inclusive.
Very.
You know,
Yeah.
Susan, I think the other thing is many folks that work within these more structured siloed organizations, they recognize the caregiver. They recognize the gap. And so it provided them with an avenue for them to see as an opportunity to really kind of vent and share and explore possibilities of how they can work within their system to think about the caregiver as well. So as Marilyn said, we're kind of the only entity in Idaho that is out there, you know, broadly and openly focused on the family caregiver. So it's a synergy of things.
Our parent training center is the director of that, sits on our leadership team. So we have a lot of good kind of communication exchange with what families of kids with special needs are facing. And they are a very active statewide entity. And they have also the family grant for Idaho. So that kind of gives us that lifespan respite that we might not otherwise have.
Yeah, that's really interesting. That's a really valuable group because parents are really supporting parents early on, for example, when they have a child who has a disability identified, and they are a powerful force. But if they're just sitting at the table and don't have a voice, that one of the things that you talked about, one of your early values, I thought was really important. And then you talked about having indicators to show how family caregivers were involved, like what, you know, through the annual conference. And I can remember when we were, the federal legislation first came out for infant and toddler services. I was involved with that for Washington State. And so we did the partners in policy making. That was one of our indicators. We paid for travel and vouchers for childcare so people could come to meetings. So we really supported them. And we also put, when we have big statewide groups, we had as many caregivers as we had bureaucrats and university types. And we had bells around the table that people rung every time somebody used jargon. So you had to talk in plain language. And they sound like, you know, these little small things, but they're not, because then the caregivers have a strong voice. And if you can't articulate it, people are not going to get what you do, which is so obviously valuable when you can articulate it.
One of the things we've been working on more recently, really as a kind of a product of the pandemic, is we're working with our independent living centers, our state DD council, and others on the direct care workforce shortage because of the impact that had on family caregivers during the pandemic. I mean, it was bad before, and then it just accelerated. And so we've got a lot of work that we're doing collaboratively with them to, we just got, our DD council just got a request for a study by our Office of Performance Evaluation about the direct care workforce shortage in Idaho, specific for people with disabilities and seniors. So there's just a lot of those kinds of things that we partner on. Sometimes we take the lead, sometimes someone else takes the lead.
Yeah. Well, I don't want to monopolize. I can talk, but do other people have things that stood out for them? Any questions before we only have 3 minutes left. I'm
I've
sorry
added
to
some
say.
notes to the chat about questions about the consultant. Again, we'd be happy to make connections, but that details in the chat.
And I just have to give a shout out to this university partnership, which I'm an advocate, and I see so many state grantees that have these partnerships because, you know, you heard them mention that they use data to make decisions and that they meet annually, but that the leadership team meets more often. They have information, and I just wrote your state summary, so I know this is true of Idaho. There's like data in there. They know what's going on from minute to minute. They can demonstrate the efficacy of what they do, which is so important for sustainability planning. Other people, what did you notice? New York's another strong state, but we haven't heard from them. What are you all thinking?
I asked a few questions in the chat, so thank you for responding. That was very helpful. Yeah, it's all exciting. It was a great presentation. I have a lot of thoughts running through my head. I had sent a note privately to Doris too, just to kind of see what her thinking is. But this is actually something that we had put in our grant proposal, was developing a business plan. So we are very interested in it. It's something that's on our to-do list. So we'll likely follow up with some additional questions. So thank you.
And
thanks,
so,
Dina.
Yeah, it's really nice to see how all these pieces fit together. And then I would just say for states that aren't this far along, it doesn't matter. They, you know, Idaho, New York, they weren't this far along years back. It's the trajectory and having the pieces in place to support that forward movement. So I thought this was really wonderful.
I'd love to hear from New York State in terms of, again, this lifespan perspective being under an office for the aging. We are, you know, our aging entity is outside of health and welfare, outside of the human services. And so we're not quite the same as what Oklahoma just tried. Wondered how that looks for New York.
We aren't like Oklahoma either. It's been challenging, but I can say we've made great progress. I don't, Doris agrees with that, but I feel like we've just, with the work that we do, and yes, knocking on doors, making new connections, you know, strengthening our partnerships at the state level. I think we've made great strides since 2016, but there still are a lot of silos, and we don't have access to Medicaid dollars. You know, that's been a difficult, I would say, you know, a difficulty for us here in New York. But we, meaning the coalition and the State Office for Aging, do a lot of work collaboratively. And I think that that has really put us on a good path of, you know, just with our strategic planning, our brainstorming of like figuring out, okay, who do we have to tap into and who knows who where to like get that connection made. So, you know, I don't know if Doris, you want to share anything more than that, but that's how I've been seeing it. I've been in the role for 5 years now. And we've made some progress, but we still have a lot of work to do. You're on mute.
Oh, there we go. Okay, sorry. I was doing it on my phone. Anyway, I think because it's lifespan respite funding, and just because it comes through the Office for the Aging recognizes what the goals and missions of the coalition are. And I think the coalition is kind of a separate entity that's been allowed to work that stream, not necessarily aging, but I will tell you the connections that we have because of our connection with the Office for Aging are immense, just absolutely immense. Because I think the director of the Office for Aging has his hands in all those silos to some degree. He has connections there, and he's very open to helping us do that.
And the nice thing is we're a very small agency. I mean, fingers crossed, we're supposed to be getting about 35 new staff, but you know, we're down to 85 people. And that's very small for a state this large, for a state office for aging. So I feel like that's nice though, because we all know one another. And so like we can certainly feel comfortable in going and knocking on someone's door and being like, you know, hey, do you have a connection here? Or do you have a connection there? And Doris is right. Like Greg is so supportive of lifespan respite work. And yes, he has many connections with our sister agencies. So he's a great asset in that regard.
I have a question, a quick question. In the beginning, you were talking about your 1,500 people and organizations. Do you consider them your membership? And is that basically your mailing list, or is that, yes?
Yeah, Doris, that we consider that our membership. We don't have a membership, a formal membership with dues paying, that sort of thing. If you participate in our conference and want to receive our mailings, which are all email generated or social media, then we add your name to the list. And that's how we've moved over the last couple of years. We've tripled that list.
Yeah. We're always growing our list, and that's kind of what we do, but we struggle with the definition of membership. It's nice to see that that's kind of what you're doing as well. I think we're going to tackle that question because it's been at the top of our list or floating around there for several years now. So that's good to hear. That
We would love
so formal.
We would love to hear what you come up with or what you encounter.
Okay. And I'll tell you, I was talking to my boss the other day, and she goes, "Oh, let's be honest, we can't sustain this without some kind of government funding." And you know, that's kind of a harsh reality, because at one point we were looking for membership as a way to kind of sustain the organization, but I don't think that it could be big enough or robust enough to even come close to supporting the coalition. So you know, part of our sustainability planning is always to be on the lookout for those other streams of funding that we could tap, and I think we do it pretty well. So, but it's true. I'm not so sure it is all that sustainable without some kind of government funding. Am I being negative?
No, I think you're being realistic. You know, but back to the coalition, our coalition's pretty active too, and I call them all partners. I don't get into the membership. I don't want to charge fees. I don't want to go there. So we just call them all partners, our coalition partners. And we're like you, we have lots of them. And to sustain that, the coalition, we have the annual conference also. And what we do is we have lots of vendors, even though it was virtual. And that's the vendors. We charge the vendors, and they sustain our coalition for the conference. And we have other little events that we have too, but we have great partnerships there, and that's who sustains our coalition. So don't know if that's helpful or not. I'd never want to go down that charging membership fees. I don't want to go down that road. So that's how we've come up with being able to sustain our coalition, is through charging vendor fees at in person and online events. And we've had
done
great
that for our
success.
conference too, Nadine.
Yeah, great success. Yeah.
And in fact, one of our healthcare plans underwrote the Spanish track.
Yeah.
At our conference.
Yeah, they're willing to do it. You just have to put it out there to them. I mean, we've almost been like, you know, we're good now. We're good. We got enough sponsors, but you don't want to turn money away. I mean, that's free money you don't have your hands tied on that stuff. So
right. Thank you, Susan, very much for allowing us to share.
I'm so grateful, and I'm so proud of the work this network is doing, this group is doing in particular. Is a